So here we are. Okay, so I want to take a backward look at what happened. In fact, what happened, it's very interesting, because for the first time in history, we were able to take science into action in a very short time. The world, facing a pandemic, decided that the main tool that we can use in terms of both medical response, political response, and a strategic response was a vaccine. Why a vaccine? Well, first of all, because the vaccine is the most cost-effective tool that we have in public health. So before COVID, there was a study by the Johns Hopkins University showing that in low-income countries, when you invest $1 into vaccines, you get only in return of the health systems 16. But that was not the reason why the whole world started to invest on the vaccine. The whole reason was because we stopped everything. Everything was stopped. Commerce, trade, tourism, social relations, everything was closed. So at that point in time, the security agenda said the only way in which you can feel good to open again, good to control this, is by having a vaccine. So to stop a pandemic, we need a vaccine, that's for sure. But we not only need a vaccine, we need this vaccine to reach all people. Because if it does not reach all the people, the problem is that the virus, all the virus, have mutations, all of them. So the less people are immunized, the more the virus will have a new mutation, a new variety, which means that in those places where there is no immunization going on, then you will have much more capacity to have the virus in a new version that might affect us that we have been vaccinated. So that's the reality. So we need the vaccine, and in fact it took 333 days since the genome of the virus was identified up till the time when we get the first shot of a woman in Coventry in Great Britain. 333 days, which is 6 years less than the fastest vaccine ever. Normally, to develop a vaccine, it will take in between 10 to 20 years. Some vaccines have already been, have taken more than 1 century to be developed. So it was very good. We had a vaccine. How to bring it to the whole world? That was the problem. And the problem was said, okay, we need to create one organization, so to buy vaccines and to give it to the countries that cannot pay for them, to subsidize. Why? Because they are good, because they are nice, because they are close friends? No, because borders are no longer any kind of barrier. So we need them to be as safe as we are. Otherwise, we will not be finding that. That is true for the world, but that is even more true for the Mediterranean space, which is the place in which we live. So probably when we asked Professor Fadi El-Jardali to talk a bit about the whole issue about public health and bring it to decision makers, we can also take a picture of what's going on in Lebanon. He's coming from Beirut, in Lebanon. What's the difference in between one country, such as Israel, which is neighboring, almost 100% of the people, the first country to have all the shots, and Lebanon, with probably 30%, 35% vaccination in the first year, but now not even 50% vaccinated people. What does it mean? I mean, in between the Lebanon and Israel, the borders might play a role, but this is not happening in between Morocco and Spain. Morocco closed the borders. They closed completely. And the good thing here is that the European Union acted for the first time ever as a state. They said, we will be buying the vaccine for all the Europeans. Good. Why? It's solidarity? No, it's the same rationale. Because in Germany, which was the only country in Europe that might have bought the vaccine for all the population in the first year, only Germany could have this very fast, said, if I have the vaccine for all the German people, but I don't have the vaccine for Romanians or Portuguese, then I have to close the European Union, because Germany would be closed, and France would be closed, and Spain would be closed. So this idea about the European Union, what it's a pity is that it was not first expanded to the whole Mediterranean region, because at the end of the day, the way of transit in between ones and the others is something that made the difference on the economy, on the commerce, on the capacity to relate ones to the others. So it was not a real Mediterranean space in that sense. So with this framework, it's not me who should be explaining the lessons, but having the opportunity to have here Professor Fadi El-Jardali, I would like to ask you what are you that you devote your time to bring science into action, science into, or knowledge into decision making, what failed? How can you see the failures from your side, not only from your country, but from a global perspective, and particularly in the Mediterranean? So I give you the floor. It's a pleasure to have you here.
Yeah, so thank you so much. I really appreciate the introduction and putting things into context. I'm very delighted to be in Barcelona. This is a city that I love, and sorry for not being able to speak Spanish, but I have to tell you that I'm really interested in this, beautiful language. I've had so far covered 30 hours of, trying to learn Spanish. So hopefully I will be on the right track in the few years to come. So thanks for the opportunity. So what I thought is that maybe just to reflect a little bit on many elements that you already mentioned, Rafael, I prepared some more of some slides just to kickstart this type of discussion. I'm not going to go into the details of those slides, but I just want to actually reflect on some of the key messages that we already learned, and what we've learned about the evidence to policy interface. I have to say, I've been working in this space for more than 15 years, how to bring evidence into policy. I came from practice as an administrator in a hospital, then moved to government. I work in 3 levels of government in Canada. I worked with the key decision makers, the policy makers, before I moved to academia. So I see my role now is trying to push more evidence into policy and practice. But we've learned a lot, in fact, over the last many years. But one important thing that came out from the pandemic is that this is the first time I actually hear heads of states, president, prime ministers, politicians talking about the importance of using evidence in decision making. I think this is an important, I would say, I always look at the glass half full, not half empty. So I think this is an important progress that has been made. So meaning now there is more acknowledgement of the role of data, evidence, real-time response, rapid response at the time of crisis. And we've learned a lot over the last, at least over the last 2 years as a result of the pandemic. But before I go through, I thought maybe I'll actually put some thoughts related to slides. I'm going to go over them very quickly, and then we'll go into this in terms of... maybe if we can put the slides on the... now, they are in English, so but again, this is really not I will not go over in details with them, but I think it would be important just to more reflect on some of the learning that we already have.
It's not here, but you can...
Yeah, it's already here. So I'm already here. So let me oh, here we go. It's working. So I'm actually wanted to mention that I'm here actually to put some messages for you. I think one important, and I thought to start my talk with the key messages that I want to convey in this session. The first one is that, health now is a matter of security and development issue. I think we have really quite a clear case for why is that. We need to certainly rethink the global health security architecture. So basically, health security now must be tied to health system. They cannot be really separated. Certainly, we need to reinforce health security through strengthening health system resilience. And I'll tell you a little bit about what we are talking and doing about health system resilience with the World Bank and others. Certainly a strong health system is the foundation that underpins health security and universal coverage. So basically, you have seen there's a lot of inequities that happen in terms of access, in terms of distribution of vaccines and others, and that's something we can reflect on that. And basically, we need to look at health system reform as part of the governance reform. So this is very important. And particularly, for example, what I learned about in the Mediterranean, for example, in the case of Spain, there has been really some challenges in a system that is really decentralized. The central government versus the regions versus the autonomous government at the regional level, the issue about the coordination, transfer of information, etc. So this is really, so that's why when we say health security, certainly is centered on how we can prepare, prevent, and detect and respond to any shock or crisis or pandemic. Now, and I agree with Raphael saying that, the next crisis or the next shock or the next pandemic is not hypothetical anymore. We have and we know that this is inevitable. This will happen. If you look at the emergence of, and unfortunately, this, I have to say that, but if you look at the emergence of infectious diseases, if you look at what's happening with the climate change, in this change in the temperature, you know that there will be some type of viruses and infectious diseases in the future. Now, the question is what that means. Of course, it will endanger the collective health of the population across different regions. And we've seen from the pandemic that you cannot think about your own nation. You cannot think only about vaccinating your own region, because your security, your health is dependent on security and health of other populations. So this is really, and that's why we've seen, unfortunately, a failure in global solidarity. We had also seen failure in the moral approach to decision making at the global level when we go to Fed. So certainly health is becoming now a national security concern, and certainly this is really quite critical to think about. Now certainly we've seen the worst global health crisis, no doubt about that. But to be honest with you, to me, crisis showed you what the system is made of. This is very important. That's why you will see wealthier countries did not do well in the pandemic, contrary to what somebody thought. Some countries that have a lot of strategies and preparedness plan, unfortunately, they failed at the level of practice. Why? Why we thought we were really very prepared? If we look in Spain in 2017, there was some warning signs coming from the health security, I think, strategy or so, but there was no action. So the question is why the system thought that we are ready and we are resilient, but in fact, at the level of implementation, we actually thought there was some challenges. So basically, this is really quite challenging in terms of of how we think about that. Now, if you look, I don't want to go into the details, but certainly you know a lot about now what we have looked at the experiences of different countries, including Spain, by the way. Italy, France, in fact, Italy and Spain were the epicenter of the pandemic, I would say, early on. There was some delayed responses, limited real-time decision and rapid response, limited preparation experience dealing with the pandemics, shortages in resources in hospitals. Older people, unfortunately, were more affected because of the demographic in Spain. There was a managerial failing, decentralized system, central. There was, a polarized political environment, I would say, in that sense. There was no inclusive approach and transparency approach to decisions. There was, so I think these are things that we've seen it in Spain, we've seen it in other countries as well. Italy, France, also in the region. For example, in the Eastern Mediterranean region, we've seen that, this is a region that holds 9% of the global population, but 64% of refugee population worldwide. So this is what that means to it, at the time of crisis. I come from a country that we have around 1.5 million refugees in a country of 4.5 million. So imagine a country that have increased in population 35 to 40% in less than 1 year. What will happen to the resources, to the infrastructure, to the sectors, health, social, education, etc. So there's the reality that we need to understand as well about, but certainly if you look at our region, the climate change, the challenge, population mobility because of refugees, rapid urbanization, weak surveillance system. Many countries did not invest very much in public health infrastructure, fragile system. So that's why if you look at we have socioeconomic inequities. We have inequities when it comes to access. We have poverty. We have also problem with food security, and all this is quite challenging. In fact, we just published with the UNDP, we worked and we've assessed the multi-sectoral collaboration, because we've seen in COVID-19 you need to have different sectors coming together. We've seen, in fact, a lot of variation across countries. I'm not going to go into the details, but to show you that there hasn't been enough and well-prepared system to react and to respond to the pandemic. And the question that we should think about, are we ready for the next shock? I'm using the word shock and crisis, by the way, not the use pandemic, because when we talk about shocks and crisis, they are much more encompassing than only a pandemic. Yes, we might have a shutdown of the whole system in a country, not necessarily of the pandemic. It might be of another threat. So the question, how one can actually learn from what we have seen in the pandemic and not to have an ad hoc reaction in terms of what we've seen in other countries. I'm not going to go into the details in terms of this, but certainly what we have seen across the countries in the Mediterranean, we've seen limited fiscal space to respond. But government procurement system has been challenged. There was more inequality and equities in terms of mobilizing economic and health impact, difficulty of deploying surge capacity in healthcare facilities, limited testing, surveillance, contact tracing, and isolation. Challenges of maintaining essential services, particularly when we have lockdown. This was really quite challenging, and this is where many governments started to see the intersection between health, economic, and social protection in terms of this, particularly for the people that were not able to bring food to their table. So there are some structural deficiencies in health system in the Mediterranean. I think this is very important in terms of lacking emergency planning, leadership. There has been more of weak effort to engage with the broader political, social, and economic factors. And this is what exactly, Rafael, about the intersection between evidence and policy. There has been, I have to say, at the time of crisis, there's a lot of uncertainties. We do systematic reviews, we do evidence synthesis. Sometimes you don't have conclusive evidence, but you have good enough evidence to act. Now, the question is, to what extent political systems were open to people, to technical people, to bring their expertise, to bring the data, to bring the evidence to inform decision-making. That's why we've seen that the World Health Organization was trying to disseminate and inform member countries about data, evidence, about effective measures, but we've seen different variation of how countries actually use this type of data and evidence. Why? Because there was a trade-off between health, economy, and other social and political factors, and this is really quite challenging. We've seen it across countries, and even within countries. In a country like Spain, you have seen some variation also between central and region as well. So there was disruption in the medical supply chain, limited capacity as well. So there has been shortages of health workforce, fragmented information system. You've seen the pandemic. There was a huge problem with infodemics. How do we deal with wrong data? How many people still they were afraid to get vaccinated because they thought this was part of a conspiracy theory? What was the role of science here? How much we were actually trying to fight those type of infodemic and tsunami of wrong information? So these have been really quite challenging in terms of this. So what that means when it comes to moving forward, and that's why I thought to put for you more of the. I argue that we need to think global health security architecture. I think this is very important when it comes to this. So, it's very important to make sure that, this rapid threat of the pandemic really, I think, it showed us gaps and bottlenecks and loopholes, but also it showed us also some failures in how we are governing health at the global level, and how we are looking at health not as a commodity, as Rafael mentioned, but also as a matter of global health security, and how we can really make sure that public health system have now the capacity to detect, prevent, and respond to international infectious diseases. Certainly, we need to make sure that more of health security is conceptualized in a state-centric terms. So basically, we need to make sure, I think, Rafael mentioned about the vaccine nationalism, and unfortunately, more of the rush for rich countries and to able to actually purchase vaccines, but we forgot that, this is a matter of a global security. It's not only of a national security logic. So this was also an issue when it comes to this. That's why, health security must be tied to health system. I think this is very important. So basically, you cannot have a resilient global health security without strong health system. And I think we've seen that in many low middle income countries in the Eastern Mediterranean region and beyond. So I think this is very important to look at health security and health system and make sure that they are really quite interconnected. Certainly, when it says strong, resilient health system, are fundamental to national, regional, and global health security, no doubt about that. So this is really meaning when you have a strong surveillance system, when you have a strong health information system, when you think a strong lab and immunization system, procurement, supply chain, quality of care are all important, and they can help countries to mitigate and respond to stress across different regions. That's why, when we say about we need to improve health system resilience, I wanted to show you that some of we've realized that, in fact, many countries have done different strategies, but they haven't been used a comprehensive tool. How we can be future-proof, how we can have to make sure that our system is ready for any type of pandemic in the future. That's why we are working now with the World Bank. So, and we are piloting. We're piloting this tool in 2 countries now in the Eastern Mediterranean region, and we have now a health system resilience tool. The purpose is to support government, not only Ministry of Health, government, all the authorities, all the sectors in a country, of how to test and self-diagnose where do they stand, where they are at now in terms of preparedness, what are the gaps and loopholes, where do they need to go in the next 1 or 2 years, and what are their action plan. I think this is very important. So we're working on this tool. I'm not going to go into the details. This will be published soon. But we've realized that for any country to be resilient, they should strengthen governance and institutional arrangement. They should strengthen financial arrangement. They should strengthen resources and service delivery, and more importantly, invest in data and information systems. So you'll see now, sorry, I have to put this, I was moving. So these are the 4 components of the tools, and they have specific indicators. Now each country can get a scorecard now as a result of this. So that's why I'm saying that now countries should test themselves about preparedness, the shock, how we deal with shock, how we can really manage this shock, and how we can recover from the shock. So basically, this is all in terms of absorptive, adaptive, and transformative capacity. That's something countries that actually should work in terms of this. I'm not going to go into the detail of the tool, so I want to finish by just some key messages. But just to tell you now, we have a very detailed diagnostic tool for all countries to self-diagnose itself. Where do we stand in resilience? What works well? What are the gaps? What are the loopholes? And what do we need to do in the next 1-2 years? And in fact, government should be also disclose this information to the public. They should have some transparency to say, where do we stand in this process in terms of this? At the level of governance, it's a very detailed tool. At the level of financing, at the level of health system resources, and at the level of the data and information system. So that the detailed type of indicators for all of this. And this is what countries will be actually getting at some point. It's a scorecard. Do we have a beginning system? Are we beginning to improve? Do we have we're developing? Are we expanding? Or do we have a mature system? Meaning any shock that will happen later on, we're ready for it. And I think these are a moving target. This is a tool, an improvement tool, not a judgment tool. This is not the tool to compare countries across each other, but this is really more of a specific one that will be used by countries to actually implement. And the nice thing about this tool, that to answer this tool, all the sectors should work together and talk to each other. You cannot do this only to go by Ministry of Health or the Ministry of Economy or Ministry of Education. One of the nice things about the tool implementation is that the process, how to bring all the stakeholders around the table to deliberate about that. Because health is not only related to the authority responsible for health anymore. Health is really, again, part of security and development. So that's why I think, I want to mention that we need to make sure that we invest in health system, as I mentioned to you, because this is very important. And that's why if you see around the framework that is really available, they link global health security with health system and with universal coverage. To do so, you need to have a strong, comprehensive health system because it's essential for health security. So no country can claim that we have good health security if you don't have a good health system. This is very clear. So that's why there is a very, very specific detail about what needs to be done at the global health. What are the regulations that we need to change? What are the early warning systems that we need to have in the Mediterranean region? What are the emergency response systems that we have in the country? What type of disease prevention program that we have? Rafael mentioned about research and development. In fact, if you look at the latest evidence in that, I think we need to rethink the incentive model for research and development. We need to have the government to be a player on that. We need to have academic institutions that should invest in research and development, and not only in the hand of the private sector and pharmaceutical companies. And I think this is very important also what we learned. So rethinking about this whole arrangement is very critical. My worry, to be honest with you, that I'm not seeing a lot of effective intervention from governments at the national and the global level to take those lessons into action. And that's my worry. And what is the reason behind that? Why, among all the challenges that we face over the last more than 2 years, still we're not taking the preparedness for the next pandemic seriously? I think this is very critical, and I know it had a different dimension to answer. But it's very important when you talk public health. We're not talking about, people thought we can fight COVID-19 by increasing ICU beds, by actually opening more hospitals and more facilities. In fact, we've seen that you can win the battle against COVID-19 by intersectoral action, by community action, by informing, empowering citizens, by engaging with the opposition in the political system, et cetera, et cetera. So we've seen different ways of how we can. That's why we need to look at public health, not really a system of hospitals or so. That's why I want to finish by mentioning that certainly to be resilient, you need to have multi-sectoral emergency preparedness policies, plans that are tested, not rhetoric and not really, strategies on the shelf. We need to increase investment in the system to reorient it from sick care, curative-oriented system towards prevention and primary care. Certainly, many countries have now moved in Egypt, for interesting. Now they legalized, they have a law now for universal care coverage. It's becoming mandatory legislatively, so they can. It's a message for the public that they want to make sure everybody is allowed to access common benefit package. Enhance stewardship and leadership and the whole government response to the pandemic. Involvement of communities and civil society organizations. Decisions at the level of the pandemic or a crisis cannot be only in the hands of the government. The government should have an inclusive and transparent way to engage public health experts, to bring technical expertise around the table, to engage with the opposition, to engage with the communities, with citizens, in order to make sure that we have a collective decision that everybody can understand and comply with. You know why some countries many citizens were not complying with the measures that the government was putting about lockdown, about isolation, etc.? Because, in some countries, citizens did not trust government. I have to say, complying with COVID-19 measures was also dependent on how much citizens have trust in the way government make decisions and to what extent they use evidence and data in terms of that. So that's why involvement of communities, making sure that we have really a system and looking at the health from all public policy approach. That's why strengthening or speaking truth to power is very important. It should be really quite a reflective assessment of how, for example, Spain, how Lebanon, how France, how Canada, how United States. In fact, there has been a lot of published work related to that. What went wrong? countries that they thought they were well prepared for the pandemic, in fact, failed more than any other countries. So there's something actually to say about that. That's why the use of data, going back to the intersection between knowledge to policy, we need to see much more institutionalization of the use of high-quality data and evidence in decision-making. I think every claim that is being made by decision-makers, they should be supported by strong data and evidence, and high-quality evidence. I think this is very important. And I know many countries now are really working on that. In Canada, for example, in the Ministry of Health of Ontario, where I used to work, now, any recommendation you put to decision makers, for example, in the Ministry of Health for action, you need to show that you've looked at 3 databases, you looked at systematic reviews, you looked at conclusive evidence before you actually try to make the case. And of course, the decision might be political, but at least technically you're providing high-quality data to decision makers. So I think we need to make sure that we have a transparent, accountable system, robust surveillance, and making sure that we leverage on the technological advancement in terms of this. And my last point is really, we need to engage, we need to not only strengthen solidarity in the Mediterranean, we need to work on the dialogue. We need to engage with different countries. We need to actually coordinate cross-border health responses. We need to strengthen cooperation measures across countries, across regions. We need to share information and knowledge and experiences in a very open and real-time and transparent way. These are important, I think, dimensions that we need to so basically, to finish, is that we need to look at the global governance. Yes, the World Health Organization have learned a lot from the pandemic, as any other international organization and the UN system. We've seen that, the go-to place for making health decisions is not only one entity globally. It's many sectors, many entities, many institutions. How we can make sure that we have really more of acknowledging these differences, but also making sure that we have solidarity, coherence, more coordination of decision, and one message going globally at a time of global crisis and a global response. Thank you.
Thank you, Professor. And, empezar a pensar las preguntas que queráis hacer, porque abriremos el espacio para preguntas, lógicamente, las inquietudes que puedan generar. Yo voy a dialogar un poco con él sobre algunos de los temas que nos ha comentado, pero irlas pensando a medida que queráis levantar la mano. Si no, los 20 minutos finales nos quedarán para preguntas, pero si tenéis alguna pregunta, podéis. Aquí ya tenemos una primera pregunta. ¿La queréis lanzar ahora o esperamos un poco? Aquí tenemos otra. Vamos a abrir el debate, pues entonces abramos lo primero entre el público y luego ya continuaremos. Aunque, let me say that you have already opened many questions right now in terms of how do we deal with this pandemic, the issue about evidence, bringing this evidence into the decision makers. I remember perfectly at the beginning of the COVID, for example, here in Spain, we had one researcher in concrete of our team, epidemiologist, who said when we had the first case in Spain, he said, this will be happening as it is in Italy, exactly as it is. It would be massive, and it would be lasting for 2.5 to 3 years, because we are doing nothing. Yep. So we had this evidence, yep. But politicians were not ready to lockdowns and so on. The balance was very difficult. So yep. We will probably perform them. But there are questions first, and then we can go for the questions. La pregunta aquí.
Buenas tardes. Primero una consideración que siento que sea pesimista. No soy un experto en sanidad ni médico, pero sí quiero transmitir mi impresión como observador. Yo creo que la lección del COVID y algunos otros fenómenos es más bien negativa. Cuando la pandemia se utilizaba mucho la frase aquella, esta es la ocasión para, puntos suspensivos, muchas cosas. Cambiar el modelo turístico, cambiar el modelo de la solidaridad intergeneracional, internacional. Lo cierto es que yo observo más bien un repliegue, como consecuencia de esto, un repliegue hacia lo nacional, hacia el bloque. Ahora mismo estamos en una guerra que es la del bloque occidental, la OTAN, contra el bloque exsoviético. Bien, lo que funciona ahora es un repliegue nacional. En Gran Bretaña hay un repliegue hacia lo neoliberal. La primera ministra esta es realmente fantástica. Y eso se hace, vaya, aunque se hunda la libra esterlina, vamos a saco. ¿Vamos a saco en qué sentido? Retiramos las ayudas a los vulnerables y bajamos los impuestos a los ricos. Lo que quiero concluir es que yo no veo el panorama tan el médico forma parte de un asunto global. Y la situación en Italia o la previsible en Brasil indica también un repliegue hacia los valores nacionales tradicionales. No hay un concepto humanidad conjunto, no existe. Lo que ocurra en Afganistán nos preocupa, nos molesta, pero es su problema. La conclusión es, la pregunta, ¿no cree usted que está ocurriendo que en la distinción entre lo urgente y lo importante, lo urgente se nos está comiendo lo importante? Gracias.
You want to answer to this question, or we have another one and then we can have both, whatever you prefer.
Sure.
Yeah. Pues le damos la pregunta aquí y que así contestará a las dos.
Gracias por la presentación. Thank you so much for the good presentation. I think it's a little utopy, but I agree it's good and very positive to be optimistic. Creo que es muy utópica la presentación y ojalá que se cumpla en el futuro, pero estoy de acuerdo con el otro la persona de la audiencia de que no estamos yendo en un mundo global. In fact, I doubt the authority of the European Global World Health Organization or any global health authority. I doubt about that. If you can contradict my opinion, I would appreciate very much. Creo que falta una autoridad mundial sanitaria y no creo que la OMS lo esté cumpliendo. Quisiera mencionar que si hemos aprendido, quisiera preguntar si hemos aprendido algo entre los diferentes países. Por ejemplo, la forma en que China ha hecho su control sanitario nos sirve como buen ejemplo o no lo podemos aceptar en una sociedad democrática. Quisiera saber si el hecho de que se haga una vacuna en Rusia, diferente del resto del mundo, es un buen ejemplo o no podemos aprender unos de otros. El hecho de cómo se llevó la pandemia en la India, donde había millones de personas acumuladas, muchedumbres atrapadas en los lugares públicos, nos ha servido para aprender algo. Hay big data, hay evidencia científica de que en realidad da lo mismo todas estas medidas sanitarias, todas las restricciones, porque el virus depende más de condiciones climáticas, tropicales, que de otros temas. Por supuesto que la vacuna es el número uno, pero ¿los otros factores son realmente tan importantes? ¿Hemos aprendido algo unos países de otros? Nada más.
So probably we can go first to the
Sure.
return to the nationalism of the countries and what are the consequences for that, and then we can go to are the global responses efficient?
Sure. Well, these are important questions, I have to say, and we can speak a lot about that. I think I would definitely agree with you. I have the same worries as you, because at the time of the pandemic, we saw that, in fact, countries would be starting to think in a much more egalitarian, much more encompassing, and take into consideration the humanity approach to how we make decisions. Unfortunately, we've seen because of the pandemic, many countries became protectionist. So they started to actually only think about their own citizen, their own border, and this was the worst thing that could ever have happened at the time of the pandemic. So I agree with you. I think I think the challenge we have at the global level is really about the whole system about accountability, the whole system about who's accountable and how that we can promote this type of accountability at the global level. When we think about the United Nations, we think about institutions that actually focus very much on those collective decisions, collective problem-solving approaches from all states in terms of actually making, but we have seen, unfortunately, also some challenges and failure in the way decisions are being made. So that's, I'm just, it's not to answer the question, more of to reflect my worry at the same time. Absolutely, the urgent, unfortunately, is eating the important, as you mentioned, to put it in your own term. To be honest with you, we're seeing it in the refugee crisis. Look about what happened in the refugee policy problem. Now, if you see all the international agencies, all the funding is going to solve the Ukraine or to support Ukraine, which is of course, for the valid reason. But what we have done in terms to sustain operation for the country that were really battling with refugees, whether Lebanon, whether Jordan, whether other, because of the Syrian crisis. So moving and jumping from one crisis to another just because it's urgent, it doesn't mean that you've solved the previous crisis. In fact, the situation will even get worse because you haven't closed the loop. You were not really quite more of. So there is an issue, there is a call for the international community. If you look at policymakers in many governments, including my country, when they say, okay, how we solve this refugee crisis, how we can make sure that they have immediate access to basic needs, education, health, etc., they all look at the international community, but also the international community is not, in fact, able to provide this type of support in a sustainable, scalable way without a clear solution of how we're going to deal with that. So I agree with you. Unfortunately, in policymaking, priority change dramatically in a very rapid way. The question how we can hold those decision makers, whether at the level of international community or not, or countries, accountable those type of decisions. Unfortunately, we fail still at the global level to deal with this. So if you say, even if you see how countries responded to COVID-19 and COVID-19 measures, there's no checks and balances. At the end, it's the country decision. Yes, they have to look at what WHO is really providing recommendation, but it's not binding. So WHO doesn't have the power, the World Health Organization doesn't have the power to put countries on hold or accountable for a decision that was not informed by evidence coming from WHO. Again, it goes back to a system of accountability, to political system, to economic factor, and others. So that's to say I share the same concern on that. And I haven't seen, that's why I mentioned my worry for the future, that there has been a lot of lessons learned, but little action has been taken. That's really in terms of now for the country. I don't know. I think the different component of your reflection. I think there are many factors that came to play why countries succeeded in managing the transmission of the virus versus other countries. Talking about climate, the demographic reality of the system. But it was surprising that we thought the richer country will have a better response. We didn't really see that. I think what you are saying is extremely important. How we used to know that and we were convinced before, which is wrong, that low middle income countries can always learn from high income countries. In fact, in the pandemic, I tell you that in fact high income countries can learn more from low and middle income countries of how they dealt with the crisis and what some of the intervention. To go back to your point about to what extent we have this type of platform to share lessons and share experiences and share knowledge. Yes, some countries are protectionist. Some countries don't like to share data. Even at the time of the early warning signs of the certain transmission of virus, we've seen it early on in the pandemic in Wuhan. There has been some limited information that has been really quite communicated because of many factors: political, security, economic, etc., etc. But how we can make sure that we have early warning system in countries? How we can make sure that all countries are transparent in detecting and communicating this data for the global cause, for humanity, for the global security, something that we haven't seen. I haven't seen really quite significant progress being made in that direction. But I think your point is extremely important.
So taking from here, and I think that most of the points that you have already raised are connected one to each other. So also with the questions that they have said. So when you said one of the lessons that we've learned is, and you were saying right now, some high-income countries could have learned from low and middle-income countries in terms, for example, of preventive action, in terms of campaigning, in terms of reaching communities and so on. Because at the end of the day, the experience shows that all these countries, normally they work on public health because they don't have treatments, they don't have good health systems to treat people, and so on and so on. And then you said one issue that I noted down, which is we need data and evidence to convince our decision makers to act. But I wonder, and that's the question, and goes into, are we prepared for the next pandemic? Because do you think that even having data and evidence, the governments are ready to take tough decisions on their population unless there are people dying? If there are people dying, then the question changes. But what about that?
Yeah, well, it's a great question. I have to say that that's why we're convinced that sometimes you might have high quality data, including from systematic reviews and other pre-appraised type of evidence, but sometimes no action is being taken. So if you look at, there are many cases, for example, tobacco control. If you look at many countries, there's more than 3 decades of evidence about harmful effect of tobacco. Some countries have actually legalized it, reduced, banned it, etc. And some other countries, they are still, so there are political reasons for that, economic and others. What I wanted to say is that the availability of evidence in real time is an important variable, but it's not sufficient. Because sometimes we're not communicating evidence in the right way. We think that policymakers have access in real-time approach to data. Unfortunately, is not the case. If you look how conflicted data emerged from countries during the pandemic, meaning the different type of data on the same thing, different type of indicators, so there were huge issues with local data, local evidence, validity, accuracy. So that's why countries should invest in something called knowledge translation platform. What is knowledge translation? It's the intersection between evidence, policy, and politics. How we can bring them all together. How we can try to understand the context, understand political system, use and more of communicate evidence in a user-friendly way. Many politicians are not public health experts. Some of them, you might be surprised sometimes they are not, I don't want to talk much about it, but you don't expect that they have this type of technical expertise that you might wish even in the health authorities. The question how we can communicate evidence are we clarifying what is the problem? What is the size of the problem? What is the causes of the problem? And what is the cost of inaction? Sometimes, policymakers react in a way that if you tell them, okay, if I do this, we'll get this result. Great, I'll use it for my election, I will put it in my political platform, and I will show the government is doing great. But sometimes, policymakers react when you threaten them, when you say that we have a huge evidence now, if we don't invest in, let's say, public health, this is what's going to happen for us in the next pandemic. So it's all about, that's why we say, for me, having worked in government before, policy is a science, art, and craft. Meaning, I haven't seen any policy in the world that is 100% based on evidence. I have to say that. I hate to say this, given that I work in that space. But what is important is that how to make sure that we have created a structure, a processes, an incentive to make sure that evidence and data, high quality data, is always used as one input into the decision-making process. That's why many countries now are investing in creating those knowledge translation platform, entities that bring all those factors together in an institutional way. So basically, any proposed bill in the parliament, in the legislation, it has to be scrutinized against evidence. It has to be dissected to see to what extent the high-quality evidence has been used on it, and to inform decision makers in terms of that. That's why, for example, in my center, we work very hard of how to communicate in a user-friendly way to policymakers to initiate their interest, to tell them, okay, you have to act. You have to make decisions. There is evidence here that we can actually put it in a way that is really quite crisp, user-friendly. So that's why policymakers always like to hear the music, not only the noise. Sometimes as technical people, we always say problem, government is not doing whatever, etc. Politicians don't like that. Politicians, like that. Tell me the problem and tell me that there is a solution for that. if there is no solution, I'm not going to act. So that's why we learned over the last many years how to be strategic, how to create a momentum, how to make sure that now there is a receptivity, how to engage with media. Media is an important source of information to shape public opinion. And I'm not talking only print media and TV, now social media, which is really quite. The question, we're not putting a lot of efforts to educate people that are really influencers in social media, in print media, editors, journalists, etc., in terms of actually how to use evidence in order to shape public opinion. Because people react to emotional stories. They react, the government are doing well, a patient has died in the hospital because not able to pay, etc., etc. But sometimes we're not really equipping them with the right approach. So that's why our intervention, the knowledge translation, of how to reach to policymakers and politicians in using evidence, but in a more of a communicating evidence in a user-friendly way, how to provide the real rapid response. Policymakers want really, tell me what I'm going to do now. Tell me what I'm going to do in the next 2 days. That's why now we have something called 3-10-30, meaning we have a product that we produce in 3 days. If the Prime Minister will say, okay, we want to make a decision in the next cabinet. We want evidence on that. Now we have a template we create. In 3 days, we can give a response. You can do it. This is how you do it. If they give us more time, we can do it in 10 days or 30 days. So we've learned, among other entities, and knowledge translation platform in the world, to actually rapid response. Because policymakers always say technicians, academicians take a lot of time to provide the evidence. And the evidence is not, we cannot understand what they are saying or whatever, or they are too much complicated. Now we're trying to make sure that everything is simple. Everything is ready, but we're communicating it in real way. So that's why in the COVID-19, we invested a lot in rapid response system, how to provide real-time response. If there is uncertainty about the evidence, for example, vaccines. Yes, this was experimental vaccines. It was done in a short period of time, but there has been also a lot of unknowns. The question is, are you transparent about the unknowns? Are you saying this is what we know and this is what we don't know? So do you know what you don't know and you're telling people about that? I think it's very important. This will improve the trust of policymakers as well as of citizens. So that's why I think this type of evidence to policy interface is a science in itself. And we have worked over the last 15 years now. That's why we support countries now and mentor and coach different countries and teams of how to create something called rapid response unit within governments, within parliament, within cabinet, within ministries. How to have those teams that can rapidly provide data and high-quality data and evidence, and fight any wrong information that can go into the policy-making process.
Yeah, and what you were saying, it's important to understand that, yes, in fact, we don't expect politicians to be public health experts. That's not a mistake. The mistake would be that they will not trust the public health experts, and that's the point in which we have to bring some kind of solution. And there, as said, media is very important, information is very important. I think, for example, taking into the case of the vaccines, of most of you would be at the beginning of the vaccine delivery, at least here in Europe, most of the people had a lot of information. In fact, they were going to the health centers, and they were saying, no, I want Moderna, or I want Pfizer. I don't want AstraZeneca. I don't want Johnson. So they knew a lot. But they were not trusting public health. They were saying, those vaccines, all of them are good. So take the one that you have. We are responsible for you so that you get a good solution. And whenever it expires, you will have another one if needed. And that's a big gap that has not been solved yet.
Absolutely.
That's a lesson that probably, if there is a new crisis from this coronavirus coming, I wonder whether most of the people will be saying, I want the new vaccine. But we don't know how much effective it is compared to the old ones. So I would like to know what happened in this eastern part of the Mediterranean, because one thing that I think that we failed completely was we have a lot of solidarity mechanisms, way of dialoguing between Mediterranean countries and so on. But at the end of the day, a country like yours was alone. You were not relying on the European Union. I can put the example of Ukraine, which was not at war at the midst of COVID. They were not getting the vaccine from the European Union because they were not European Union. They were not getting the vaccine from Russia because Russia was facing as an enemy. So then we were living like that. Yep. So what happened to the eastern part of the Mediterranean, and how do you feel that these failures were perceived from countries such as Lebanon or any other countries?
Yeah. Well, I have to say that we don't have the I would say the same mechanism or arrangement like what you have in the European Union when it comes to the different policies, treaties, and others among the European countries. So we don't have that in the Eastern Mediterranean region in that sense. So this has been quite challenging. So we haven't seen a lot of policy coherence across different countries in the Eastern Mediterranean region. So that's why there was also several variations. I have to say many countries in the region are more of to a certain extent, policy takers more than policy makers. And at the time of pandemic, sometimes, unfortunately, you have to look at what's my neighbor doing, and I will do, or what others are doing, or what I do, what WHO is really asking for. So, but there has been certainly, some drifting, some, variation in terms of the responses. And there has been also, lack of effective mechanism in terms of intersectoral mechanism in many of those countries. So they were relying a lot on I have to say in the case of Lebanon, there has been a lot of dependency in WHO for the right reason, which is great. There has been a lot, also support that we provided through the COVAX in terms of vaccinations and others. But I think this is not quite sustainable. The question really how. Going back to what that means to regional coordination, solidarity, coherence, policy framework at the time of crisis, what we have learned of that. Unfortunately, this is not, we're not yet at this stage, but I'm hoping this type of crisis will actually take us in that direction. One thing I want you to remind me when you were talking about the vaccine and the type of information, I think what we have learned that time that, decision makers are not only the people that work in governments or public sector. Decision makers can be citizens, can be people. And that's why you will see many of the intervention, no matter what decision being made by the government, if you don't reach out, send that evidence in a very simple way to lay people, to citizens that don't understand public health, but they can be convinced by the evidence. That's why now we are more working on products only for citizens, for people that have no background in public health. What do they need to know about the issue? What do they need to lobby in their, platform? How they can work with their politician? How they can influence voting and election, and the next cycle? Because how to hold politicians accountable based on the evidence. I think we need to work on the citizen. We need to work on the communities. We need to work on influencers. Believe it or not, in a country for Lebanon, we had to go through municipalities. We have to go through influencers. We have to go to citizens, to NGO, non-governmental organizations. Sometimes we think decisions are already, or evidence should be only go upward or upstream. In fact, it has to go upstream and downstream, but different modalities. Same evidence, but has to be tailored and adapted to different audience. But at the time of pandemic, you have to work upstream and downstream.
That's good. Estamos en el tiempo de preguntas. Hay una, dos. Vamos con estas dos.
Ya lo aguanto, muchas gracias. Ha sido una generosa exposición por parte de los dos. Y yo le quiero preguntar a los dos, después de la experiencia que se ha adquirido, pasado ya el tiempo que llevamos de COVID, cuando venga la próxima pandemia,
shock,
iremos a la búsqueda de la competencia más potente de tal o cual laboratorio para adquirir la vacuna más eficiente, la que más potente sea. Óigame, el desconcierto es mayúsculo, porque los gobiernos, desde las comunidades al central, no se van a poner de acuerdo. Ni se han puesto, ni se ponen, ni se pondrán. Nunca. Entonces, los de a pie, ¿qué tenemos que hacer? ¿Volver a vacunarnos con un índice de desconfianza También mayúsculo, perdón por la redundancia. Aclárenmelo, por favor.
Good.
Muchas gracias.
Well, you were talking about research and development and probably that we have to change a bit the way in which, we have to change the model. But probably you can answer and then I can give my view on the vaccines and the...
Yeah, it's a very interesting question, very challenging, and I can see exactly what you're trying to get. I think my take into this, I think, I like your question because I know you're engaged. It's very clear, you are very engaged. That's why you're asking this important question. And it's very important to create a mechanism for a real citizen engagement in decision making. And I think this is meaning citizens cannot be only passive recipient of government decisions of this, because I think you have the right to question how decisions are being made. You have the right to say, okay, on what basis those decisions were made, what type of data has been used on that. You have the right to make sure that the government has been inclusive. They took your opinion into consideration in certain decisions. I mean, not you in general, as part of citizen governance. I think we need to see that in communities. My worry, the top-down approach of decision-making at the time of crisis is very dangerous. It's very dangerous because it's only a small group of people making decisions without really having this type of inclusiveness and transparency of those decisions. So I like your question. I'm not giving you the right answer, but I'm telling you that this is exactly the type of engaged citizen and informed decision that we want to do. That's why I think we have a role to empower citizens. We have the role to empower citizens with the right data, with the right information, being provided to them in a simple way, not a very complicated way. Really tell me tell me what do I need to know. Tell me that, what do I need to ask for. Inform me what type of questions I have to say to my politicians. To that engaged, empowered citizens is a very important factor for politicians to be accountable. The worst thing could happen in any political system is that for citizens not to be engaged, to be only passive recipient or people that don't trust government, meaning they don't comply with the measures. So that's why we need to have this type more engagement, citizen panel, reflection in communities about the best models in order to actually get and be much more informed.
And to take a bit on your question and on the research and development, I think there are many questions on research and development because I think that, for example, in the Mediterranean area, much more could have been done in terms of production of vaccines, in terms of production of treatments. I don't know the exact situation of Lebanon. I know the situation of Egypt. Egypt is a very good producer of vaccines.
Now more investing, absolutely.
But they were not having any kind of a knowledge transfer and so on. So it's a pity because at a certain point it could have multiplied the action of the vaccine. So to say very clearly, we have to change some kind of issues that are related to the development of vaccines, the development of drugs, including regulation. Most countries, they rely on global regulation because they don't have capacity to regulate themselves. Yep. So they are waiting for WHO, for others, to take the decisions they might be taking in terms of which vaccines and so on. But then, and let me switch into Spanish because voy a contestarle a una parte de su pregunta, ¿no? Vendrán más vacunas, necesitaremos más vacunas, no sabemos si las necesitaremos para todos, pero sí sabemos una cosa, y es que la inmunidad en aquellas personas que están con una coinfección grave, desde una diabetes avanzada hasta un cáncer, hasta otra serie de enfermedades coronarias, que tienen inmunodepresión, están muy a riesgo. Y personas de edad que están muy a riesgo. ¿Qué edad ponemos? El dato hoy en Cataluña es, han muerto 11 personas esta semana. Es decir, mucho, poco, o si tenemos en cuenta que de tráfico mueren 3, pues es 3 veces más, o 4 veces más. Todavía estamos multiplicando por 4.
Discúlpeme, se ha dado el dato hoy, de que en UCI, en Cataluña, no hay nadie. En el Hospital del Mar.
En el Hospital del Mar hay 400 personas en Cataluña, en UCIs. 400 personas ingresadas. Y hay aproximadamente, exacto, 400 personas en UCIs en toda Cataluña, de las cuales ha habido 11 muertes, de esas 11 muertes, 8 son mayores de 80 años. 8. Y 2 son personas no vacunadas. Nos queda una que sea un caso normal, ¿no? Luego va a tener que haber una cuarta dosis. Esa dosis va a ser para aquella gente que está más a riesgo, porque son los que pueden padecer peor una pequeña ola de una nueva variante para la cual no estén preparados. Las vacunas que tenemos hoy no son estériles, no esterilizan, no impiden que nos contagiemos. Lo que impiden es que desarrollemos la enfermedad de manera severa. En un porcentaje muy elevado, no al 100%. Entonces hay que, lógicamente, vacunar a las personas que están más a riesgo. Es la evidencia que tenemos hoy. Es la que tenemos hoy. Puede que cambie, puede que venga una variante para la que estas vacunas no estén bien preparadas y tengamos que volver a cambiar el plan y empezar a pensar en vacunar a todo el mundo. Hoy por hoy parece que no. Parece que no. Pero insisto, para personas a riesgo sería conveniente. ¿Hemos cambiado el sistema? No, no lo hemos cambiado. El sistema de investigación y desarrollo sigue siendo el que hay. Y hay un tema, you mentioned that, which is governments have paid all the final research because the industry has not paid for the vaccines. Vaccines were paid in advance as a risk buy from the countries. But the countries didn't have the power to say, you should be putting this or this in this place or another. The power was in the hands of the industry, exactly. Even though they didn't pay for them, for that. So they didn't take the risk. Yep. The risk was taken mainly on a public scale. This is a big gap that needs to be thought again. How is it that we are paying for that, but at the end of the day we cannot say anything on the production of these vaccines?
That's why the incentive structure for the R&D should really be revisited as a result of that. I fully agree with you.
El sistema de incentivos creo que se entiende muy bien. Yo creo que quedaba una pregunta ya y con ella quizás vamos a ir cerrando.
Buenas tardes.
Buenas tardes.
Una pregunta para el ponente que supongo que conocerá, de un país que está al lado del suyo. En el caso de Israel fue famoso porque fue el que se dijo que era el primero que había conseguido vacunación de toda la población. La duda es, supongo que desde luego la población, los ciudadanos israelíes judíos la obtuvieron todos. La duda es, ¿los ciudadanos judíos árabes la obtuvieron también con la misma facilidad? Y luego, ¿los habitantes de Israel que no tienen nacionalidad israelí la consiguieron también?
Well, I have to say that it's interesting. More than a year ago, I was in one of the global webinars that we were really talking about vaccine nationalism, and we've seen that unfortunately there has been a lot of inequities in terms of who gets the vaccine in a country that have a lot of vaccines. So basically, in the case of the country that you're really mentioning in terms of, so there are some cases where in fact there was citizens where had more than one dose of vaccines at the time where many people that are in fact living and they didn't have any access to any type of vaccine. So this is the issue about inequity and discrimination. We've seen it, and it is a fact in terms of this. Now there's different reasons of that. I'm not going to go into this the politics of this, but that's why to me the way countries have dealt with vaccination is really it's a moral ethical question for me more than anything else. It's beyond public health. It is a moral thing. It is an ethical thing. How come your citizens have more than one dose of vaccines, while other people living in the same territories, in fact, cannot access any type of vaccines? Think about it. So that's why we've seen I think it's a moral and ethical failure in how we dealt with vaccine distribution. And also in terms of the nationalism or vaccine nationalism, I would say, which I think this is the worst thing a society can actually think, because you can vaccinate everyone in the country, but if your neighbor is not vaccinated or some people that are not citizens in your country not vaccinated, you haven't done anything.
Si es corta, una última pregunta.
Yo he seguido bastante los datos sobre vacunación en los países del mundo Este mito de Israel es falso. En su momento se dijo que había 3 países que lo petaban, que eran Israel, Reino Unido y Estados Unidos. Las cifras al final en estos 3 países son muy bajas. Muy bajas quiere decir 65%. En Israel el motivo principal es de orden ideológico religioso. Los ortodoxos y ultraortodoxos no se vacunan. En Estados Unidos también es de orden ideológico. No se vacunan simplemente porque no quieren. Y si en Israel había 2 vacunas es porque sobraban, porque había gente que no quería vacunarse. No digamos los palestinos, que esto no cuenta ni no hay que vacunarnos, nada más.
Hay muchos palestinos que son israelíes.
Ya sé.
Muchos árabes que son israelíes, vamos.
Bueno, muchos, unos cuantos.
Unos cuantos. De hecho, no dejan de ser territorios ocupados, con lo
Pero
cual tendría la responsabilidad.
en Gaza no han visto vacunas, ¿eh?
No, por eso. Pero, no, en parte tiene razón. Lo que pasa es que hablamos de la primera ola, que es cuando se tenía escasez, cuando había escasez de dosis. Bueno, el caso de Israel es un caso claro, entre otras cosas porque hace un acuerdo con una farmacéutica para utilizarse como lo que sería un ensayo clínico de fase 4B. ¿eh? Lo digo con todas las comillas. Y por aclarar el dato, son 400 ingresos hospitalarios lo que tenemos ahora en Cataluña. De ellos, un 10% son UCIs y 11 muertos. Esto lo he visto esta mañana porque además he preguntado el número de muertos.
Me equivoqué, que era en el Hospital del Mar.
Entonces, sí. Pero no sé si if you want to say a final word, I would just, after all your reflections and ideas and so on, I think that there are some lessons. We can be a bit more prepared. I don't think that we have created the big governance architecture capacity to say we are prepared for the next. And I like your word, shock. It probably might not be a pandemic.
Exactly.
But it's a shock, a global shock, meaning that it cuts economy, commerce, globalization, trade, travel, and so on. But we still don't have, I mean, probably you have read the last book by Bill Gates saying we need a kind of firemen or fire people, a body for the world to avoid the next emergency. I think that we have a lot of lessons learned. Some of them will be taken, but still we have a very complex way of going ahead, and probably we will not be taking all of them in place for the next shock. But the last word.
Well, I think there's a lot to be said here, but just very briefly, I have to say that going back to what you mentioned about the urgent and the important, from what we see, in fact, countries' intervention to strengthen resilience for their system. Based on the lessons learned of the pandemic is not only important, is also urgent. So how to create a sense of urgency among countries and regions to really invest in trying to be much more resilient, how we can strengthen that our system, how we can self-assess our sectors and our system within the country and see where do we stand and what type of intervention we need to do and what type of action we need to promise, and how we can link it to the political system, I think is extremely, extremely important. My worry that sometimes politicians are vote maximizers, so they only look at what they can do in their own tenures and when they are at the office, but sometimes they actually shy away from long-term decisions that require investment. This is an important, it's a matter of national security, it's a matter of global security. It has, meaning the rule of the game does not apply. Usually in policy we always say crises are opportunities for change because they are focusing events, meaning, the rule of the game does not apply, meaning we are all in the same boat here. Either we make it or not. I think we need to get that message now very clear to all politicians, to all government, to all international organizations, to all funders, to all donors, to actually start really making sure that we take those lessons learned. It's enough to talk about lessons learned. To be honest with you, over the last year or so, there has been a lot of discussion about lessons learned, but little also on the actions, how we can take those lessons into action. I think we need to see now clear short-term plans of how we can take it into action, how we can put it in the political cycle, how we can make sure it's part of the budgetary requirement, how we can make sure it's filtered down and cascaded down to the day-to-day operation of ministries, of sectors, of others. That's what we would like to see. And I'm hoping that we can really, from this session, hopefully some of those insights can actually make it through to have much more focused dialogue and discussion in the future.
Thank you very much, Professor El-Jardali. It's a pleasure to have you here. In Barcelona, it's always a pleasure to have a vision from you, which is coming from the other side of this region, which is a common region. So thank you very much for all your comments. Thank you, Roger Alvillana, for the Institute of the Mediterranean, Institut Europeu de la Mediterrània, and Jaume Lanaspa for Club de Roma and Fundació La Caixa. It has been a pleasure also to share with you and that you have invited us to film. And thank you all for coming here. So, good.